Hello and welcome, medical students. Today, we are going to delve into the fascinating field of pharmacology as it pertains to hepatitis B virus, HBV, treatment. Our objective is to explore the complex intricacies of HBV replication, identify potential targets for therapeutic intervention, understand drug resistance mechanisms, and discuss novel strategies for improving patient outcomes. So, let's get started. HBV polymerase is crucial in viral replication, synthesizing new viral DNA using reverse transcription. It consists of TP, RT, and ribonuclease H domains with specific functions. Antiviral agents targeting HBV polymerase can inhibit viral replication and halt disease progression through understanding its structure and function. Nucleoside analogs, NAs, inhibit HBV replication by acting as competitive inhibitors of HBV polymerase. Drugs like entecavir and tenofovir are mainly given orally, absorbed quickly, metabolized in the liver, and minimally excreted by the kidneys. Effective dosing maintains drug levels above the minimum inhibitory concentration, MIC, to prevent drug resistance and promote viral suppression. The hepatitis B virus, HBV, has a complex life cycle that includes stages like attachment, entry, replication, and assembly. Each stage presents opportunities for therapeutic intervention. For example, blocking viral attachment and entry mechanisms can prevent infection. Additionally, inhibiting reverse transcription and targeting viral mRNA transcription, protein translation, and assembly can disrupt the HBV life cycle and achieve viral suppression. Antiviral drug resistance is a significant challenge in the management of chronic HBV infection. Some HBV strains develop mutations in the viral polymerase gene, rendering them resistant to certain antiviral drugs. To overcome drug resistance, combination therapy is often employed. This involves using two or more antiviral agents with different mechanisms of action, which reduces the likelihood of resistance development. Combinations such as tenofovir and entecavir have shown increased efficacy in preventing the emergence of drug-resistant mutants. Additionally, continuous monitoring of viral load and drug resistance mutations is crucial to guide treatment decisions. This helps healthcare providers make informed choices regarding treatment regimens, ensuring optimal patient outcomes. Combining direct-acting antivirals, DAAs, with immunotherapies holds promise for enhancing HBV treatment outcomes. DAAs specifically target viral replication steps, inhibiting key enzymes involved in the HBV life cycle. Immunotherapies, on the other hand, boost the host immune response against the virus. Combining these treatment modalities can have a synergistic effect, leading to improved viral suppression and reduced incidence of drug resistance. For example, combining PEG interferon alpha-2A with nucleoside analogs has demonstrated enhanced response rates and increased chances of achieving hepatitis B surface antigen, HBsAg, seroclearance. Further research is needed to optimize combination therapy regimens and unravel the intricacies of host-virus interactions, ultimately leading to improved HBV treatment outcomes. HBV drug resistance is a complex phenomenon influenced by various factors, including viral, host, and treatment-related factors. Studying the mechanisms underlying drug resistance can help develop targeted therapies that prevent or overcome resistance. Some common mechanisms of HBV drug resistance include the emergence of drug-resistant mutations in the viral polymerase gene, reduced drug uptake, enhanced drug efflux, and altered drug metabolism. By understanding these mechanisms, researchers can develop novel therapeutic agents that specifically target drug-resistant HBV strains or develop strategies to enhance the effectiveness of existing antiviral therapies. In the video on targeting hepatitis B virus, HBV, replication, we explore novel therapeutic approaches that focus on blocking viral entry and attachment. By understanding the molecular mechanisms of these processes, we can develop agents that inhibit essential host factors or directly target viral envelope proteins, preventing infection and replication. In the drugs targeting hepatitis B virus replication video, we highlight the importance of HBV RNA and viral replication. By targeting specific regions of the viral RNA structure, we can disrupt interactions with the polymerase enzyme and inhibit replication. RNA-based drugs like siRNAs offer promising therapeutic options. HBV integrase is an essential enzyme involved in the integration of viral DNA into the host genome, leading to persistent infection. Inhibiting HBV integrase activity represents a promising strategy for eradicating viral DNA and achieving sustained virologic response, SVR. Integrase inhibitors interfere with the integration process by binding to the active site of HBV integrase. This prevents the integration of viral DNA into the host genome, leading to reduced viral persistence and increased chances of achieving SVR. However, further research is needed to optimize the efficacy and safety of integrase inhibitors, ensuring their successful integration into the HBV treatment armamentarium. Liver fibrosis is common in chronic HBV patients and affects disease progression. Invasive liver biopsy has limitations, so non-invasive methods, like elastography and serum biomarkers, have been developed. These tools help monitor fibrosis and guide treatment decisions to prevent complications. Post-treatment relapse in HBV infection is a concern. Combining long-term nucleoside analog treatment with immunomodulatory therapies can prevent reactivation and boost the immune response against the virus, reducing relapse and improving patient outcomes. The prevention of mother-to-child transmission of hepatitis B virus, HBV, is important. Antiviral therapy during pregnancy can help prevent vertical transmission and ensure the health of the mother and child. Current guidelines recommend certain antiviral agents for pregnant women with high viral loads to reduce the risk of transmission. However, the safety of these drugs during pregnancy needs to be carefully evaluated, along with monitoring for any potential side effects and long-term outcomes. Effective use of antiviral therapy in pregnant women can greatly reduce the burden of maternal and fetal HBV infection. Pharmacological advancements have paved the way for effective HBV treatment options. Comprehensive knowledge of HBV structure, drug resistance, and life cycle stages is crucial. Our goals are to prevent relapse, ensure optimal care for pregnant women, and enhance patient outcomes. Together, let's strive for a future free of HBV.